Hi, this is Courtney Floyd with PRMA Plastic Surgery. I am here with Dr. Ramon Garza III, and we are going to be chatting about a common misconception about DIEP flap reconstruction, which is that prior abdominal surgery disqualifies patients from being a good candidate. Dr. Garza, can you just briefly expand on that topic?
Sure, that's a great question. Lots of patients come to us concerned that their prior abdominal wall or abdominal surgeries will affect their ability to be a candidate for a DIEP flap. And it's very common for patients to have prior C-sections or to have had prior laparoscopic procedures and those types of things. And the answer is no, those types of surgeries don't preclude you from having abdominally based free flap breast reconstruction or a DIEP flap. One thing that should be done is, obviously an evaluation by your plastic surgeon. We want to know your full surgical history. So if you've had a hernia repair as a child, that's something important for us to know. The main concern is that the blood vessels that give the DIEP flap its blood supply have been injured or have been compromised, and that would be the only thing that would affect your ability to have a breast reconstruction using your abdominal tissue. So when patients come to the office and I'm discussing the surgery they've had and why it's a concern for me, one of the things that we'll look at is where their scars are. So if this is a little drawing of, here we go, of the drawing that I use when I describe this procedure to patients. The blood vessels you see on each side here are the blood vessels that are used during the DIEP flap procedure. They come off near the groin. They come off the external iliac vessels in the groin area. They send a branch called the deep inferior epigastric artery, and that's where the DIEP flap gets its name from. And these blood vessels travel from the groin area up to the abdomen. They travel through the rectus muscle, and they eventually give the skin and fat its blood supply. So the concern is when I have a patient that's had prior abdominal surgery, is any scars or incisions that have been created in this area here could potentially injure those blood vessels and keep me from being able to use your abdomen as a donor site for the DIEP flap. C-sections usually are in between the two vessels. It's very rare to have a C-section scar interfere with our ability to do this. The concern that I have is when someone has a history of an open appendectomy or a hernia repair in the groin. Sometimes even as an infant, this can be done and potentially injure these blood vessels. But if that is your scenario and you've had a prior surgery that we're worried about these blood vessels being injured, it doesn't mean that you can't have the surgery. It just means that further investigation needs to be done to make sure that those blood vessels aren't injured and compromised. And that usually is in the form of a CT scan where we give contrast and we physically look at the images and make sure those blood vessels are still intact and that you're still a candidate for the DIEP flap.
Very good. Can you expand a little bit on what some common prior abdominal surgeries are that patients typically have that do not disqualify them from being a DIEP candidate?
Sure. So we touched a little bit about the C-section. So C-sections are a very common procedure that patients have had if they've had children. Laparoscopic cholecystectomy is another common procedure that I encounter with patients that have had prior abdominal surgery. Sometimes patients have had prior liposuction, and this is a very common misconception that if you've had liposuction, that automatically disqualifies you from having a DIEP flap procedure. Oftentimes, liposuction does not injure the little blood vessels of the skin and fat area. In those situations, I would generally get a CT scan to confirm that the blood vessels are still adequate, but the majority of the time they are adequate for using that tissue as a donor site. The main issue with liposuction is that too much fat has been removed and you're not going to have sufficient volume left for the breast reconstruction. But technically it still is feasible to perform. Other surgeries that I've seen are prior hysterectomies, ovarian procedures or gynecologic procedures. Those generally involve incisions near the midline or kind of like a C-section type incision, and I have not had that be a significant problem with affecting the ability to perform a DIEP flap procedure.
And are there any abdominal surgeries that would disqualify a patient from being a DIEP candidate?
Yes. So if you've had prior tummy tuck, that is an absolute contraindication. That's really the only surgery where if I see a patient's history and they've had a tummy tuck, automatically it disqualifies them from being able to have a DIEP flap procedure. You know, the open appendectomy, where they've had a prior scar in the area where the blood vessels are, the inferior gastric vessels are, that's something that doesn't disqualify them. But again, they would need a CT scan to make sure the blood vessels are intact. And then any inguinal surgeries, inguinal hernia repairs, in particular, the blood vessels live in that region. So you've had a mesh repair with your inguinal hernia. I would absolutely recommend getting a CT scan to evaluate the blood supply.
And do complication rates go up if a patient has had prior abdominal surgery?
In general, no. The complications that we would typically see from patients that from a DIEP flap donor site would be a wound healing issue. If somebody's had a prior scar like a C-section or any low transverse incision, that doesn't really affect the ability of those tissues to heal significantly. If they have a very low C-section scar and I'm not able to place the incision of the lower portion of the DIEP flap, just use this for to illustrate that. So if they've had a prior C-section scar that is very low and I'm not able to extend my flap lower border to that lower incision, that intervening skin can be somewhat compromised. In that scenario, that can present an issue. I haven't had that be a significant issue for patients. The one incision pattern that does give me some concern with a DIEP flap with respect to wound healing and complication is someone who's had a prior gallbladder removal via an open incision. So that's called an open cholecystectomy scar, and it's right underneath the ribs on the right-hand side. It usually involves a scar pattern like this in this upper quadrant area. And for patients that have that particular scar pattern, it can present a more an increased risk of having complications at the donor site. But we do things to minimize that, such as limited undermining. So we're just a little bit less aggressive when it comes to taking tissue from the abdomen. So just being more respectful of the tissues and not injuring any blood supply to the overlying skin is very important in those scenarios. But that's how we help mitigate complication rate in those particular patients.
Okay, and then you've talked today about CT scans being an option to, or as a test prior to surgery to determine if a patient is a good candidate. Are there any other tests that surgeons run on patients to determine if they're a good candidate or not?
Yes, so we do, as part of the workup, we would do routine blood work. So if a patient has had prior risk for clotting disorders, that they've had, a history of miscarriages, 3 or more miscarriages would be a kind of a number that would stick out. It's like that, can be unusual. That can lead to further blood work testing. But as far as evaluating the blood supply, MRA, which is an MRI type study, and CT scan, a CTA, are the best at visualizing the blood supply with somebody that's had a history of abdominal surgery. When we do your evaluation in the office, we use a Doppler to look at the blood supply on the skin surface, but that is not the best way to determine if the blood vessels have been affected. It can help guide us with our decision making, with planning and things for surgery. But if you've had a prior abdominal surgery, ones that would give me concern or pause to use your abdomen as a donor site, the CTA or the MRA is going to be the best at evaluating those things.
Okay, and one final question. How do prior abdominal surgery scars impact the final abdominal scar placement after DIEP surgery?
That's another great question. Every so often I'll have a patient who has had a prior abdominal surgery, and it will affect the placement of the final scar. And I can kind of illustrate that again using my little whiteboard here. So one patient scenario that I see every so often is someone who's had a prior appendectomy as a child, and their scar for their appendectomy is relatively high up on their abdomen. So you can see here. Let's see. Here we are. This scar pattern placement is going to be almost exactly in the middle of where my flap would typically be designed. If I have this incision pattern, I'm going to get a CTA. If my CTA shows that the blood vessel is intact up to this location, but I don't have any perforators or blood vessels coming below this scar, and they only come out above the scar to give the skin and fat its blood supply, then I cannot reliably use this skin below this scar. The skin and fat below this scar are going to be unreliable. They're not going to have a good blood supply, and ultimately that can lead to fat necrosis or wound healing issues, or just affect the way the aesthetics of the reconstructed breast look. So in this particular situation, I'm going to shift the design of my flap in a cephalad location, or more higher up on the abdomen, and the incision pattern is going to look something like this, where the flap is higher than I would otherwise place it. We always try to place our scars nice and low so they're hidden in the underwear line. But in this scenario in particular, the incision pattern is going to be changed, where the ultimate scar very likely will be high up on the abdomen near the belly button, or almost at the level of the belly button. But that's something that I would discuss with my patients preoperatively. At PRMA, we have lots of experience operating with patients who've had difficult, challenging cases, have had prior abdominal surgeries, maybe have been deemed non-candidates by other plastic surgery offices. But we've done these procedures in patients who have had open appendectomies, prior mesh placements, prior hernia repairs. And as long as we can do a good preoperative evaluation, do our studies that we need to do to determine that they're a candidate, we're usually able to perform these procedures with a high success rate.
Wonderful. Thank you so much, Dr. Garza, for taking the time to talk today. And for viewers, if you have more questions about prior abdominal surgery and DIEP flap, please feel free to leave us your questions in the comments below, and we will answer them for you. Thanks.